Ever wondered how art can help in dealing with depression and anxiety? Art therapy is not merely about creating pretty pictures. It's a powerful tool gaining recognition in the mental health field, one that uses the process of creating art to improve mental, emotional, and physical well-being. Imagine the human mind as a complex labyrinth. Sometimes, words fail to navigate its intricate pathways where emotions and thoughts intertwine. This is where art steps in, serving as a form of nonverbal communication, allowing us to express what's otherwise difficult to articulate. Art therapy is not about being a great artist or creating a masterpiece. It's about exploring your inner world and expressing your emotions through colors, shapes, and strokes. The act of creating art can be therapeutic in itself, providing a sense of calm and relaxation. It's like having a conversation with yourself, a dialogue that takes place on a canvas or a piece of paper. Art therapy is a powerful ally in managing mental health issues such as depression and anxiety. It offers a safe space to explore feelings that may be too painful or confusing to express verbally. Art can serve as a mirror, reflecting our inner state and helping us understand our emotions better. The beauty of art therapy lies in its ability to reach out to people across all ages and backgrounds. Whether you're a child struggling to understand your feelings or an adult trying to cope with life's stresses, art therapy can provide an emotional outlet, a way to express and release pent-up emotions. In a world where mental health is gaining the attention it rightly deserves, art therapy is shedding its cloak of invisibility. It's stepping into the limelight as a potent form of therapy, a medium that combines the power of art and the science of psychology to heal, inspire, and transform lives. Now, you might be curious about how exactly does art therapy work? Let's dive into it. So, how does art therapy work? It's not just about creating art, it's about the process. Art therapy is a unique blend of art and psychology, a tool that allows individuals to communicate and express themselves through the medium of art under the guidance of a trained art therapist. This process typically begins with the therapist creating a safe and supportive environment for the individual. The first step isn't about the quality of the art, but allowing the person to feel comfortable expressing themselves creatively. The therapist then introduces art-making activities tailored to the individual's needs and goals. This could involve painting, drawing, sculpting, or any form of art that allows the individual to delve into their inner world. This artistic journey is not a solitary one. The art therapist is there to guide and support the individual, helping them to navigate through their emotions and thoughts that come to the surface during the process. The real magic happens when the individual starts to translate their feelings and thoughts into visual form. It's like a personal language of symbols and images that represents their inner world. This process can bring forth emotions and thoughts that might be difficult to put into words. For some, it's a way to express pain, anxiety, or depression. For others, it's a pathway to understanding their feelings and experiences on a deeper level. The therapist and the individual then reflect on the artwork together. This reflection is a crucial part of the process. It allows the individual to gain insights into their emotional state and life experiences. It can be a profound moment of self-discovery and understanding, a stepping stone towards healing and self-growth. Art therapy is not about being a great artist or creating a masterpiece. It's about using art as a tool for exploration and expression. It's about finding a voice when words fail. It's about the journey of self-discovery and healing. It's about the process. We've seen how art therapy works, but how effective is it? Let's look at some real-life examples. Real-world examples always give the best insights. Here are a few case studies that show the effectiveness of art therapy. Our first case brings us to the story of Emily, a 28-year-old woman who had been grappling with deep-seated anxiety for several years. Emily found solace in art therapy, where she began to express her feelings through vibrant color palettes and evocative imagery. Over time, she noticed a significant reduction in her anxiety levels and an increase in her overall happiness. Emily's journey is a testament to the transformative power of art therapy. Next, let's take a look at Thomas's journey. Thomas, a 40-year-old man, was dealing with severe depression. Traditional therapy wasn't providing the relief he sought. He turned to art therapy as a last resort and found it to be a game changer. Thomas used sculpture as his medium of choice, molding clay into shapes that mirrored his emotions. The tactile experience provided him with a tangible way to confront his feelings. Over the course of several sessions, Thomas reported feeling a newfound sense of control over his depression, symbolizing his progress through his evolving clay creations. And then we have Sophia, a teenager who was battling social anxiety. Sophia found it difficult to express her emotions verbally, but art therapy opened up a new channel of communication for her. Through detailed sketches, she began to externalize the fears and anxieties that had been causing her distress. Her artwork became a visual diary, a safe space for her to explore and understand her feelings. Sophia's progress was remarkable. She reported feeling more confident and less anxious in social situations, attributing her growth to the expressive outlet art therapy provided. Our final case study is about Anaya, a 60-year-old woman who was dealing with the loss of her husband. Anaya was consumed by her grief and loneliness, finding it hard to move forward. She found solace in art therapy, using painting as a way to navigate her feelings of loss. Each brushstroke became a part of her healing journey. Over time, Anaya found that her paintings began to reflect hope and positivity, mirroring her gradual emotional healing. Art therapy helped Anaya transform her grief into a process of self-discovery and growth. These case studies are just a glimpse into the life-altering impact that art therapy can have. Each individual, with their unique experiences and therapeutic journeys, underscores the power of art as a form of healing. Whether it's through painting, sketching, or sculpting, art therapy provides a creative outlet for individuals to express their emotions, confront their fears, and embark on a journey of self-discovery and healing. These case studies show how powerful art therapy can be. But what does science say about it? Believe it or not, there's a lot of science behind art therapy. Indeed, it's not just about creating beautiful artwork or expressing oneself, but there's a whole neurological process at play. Art therapy stimulates the brain in unique ways. It engages the parts of our brain involved in visual spatial processing and fine motor skills. But that's not all. It also taps into our emotional centers, helping us express and process feelings that might be too complex or painful to put into words. Research has shown that art therapy can have a profound impact on mental health. A study published in the Journal of the American Art Therapy Association found that just 45 minutes of creative activity can significantly reduce stress levels regardless of artistic talent or experience. This is likely due to the release of dopamine, a feel-good chemical in our brains that's associated with pleasure and reward. In another study, researchers used functional MRI scans to observe the brains of participants before and after a series of art therapy sessions. They found that art therapy not only reduced symptoms of stress and anxiety, but also led to noticeable changes in brainwave patterns. These changes were associated with improved mood, better focus, and enhanced cognitive function. More than just a feel-good activity, art therapy can actually change the way our brains work. It can help rewire our neural pathways, promoting flexibility and adaptability. This can be particularly beneficial for those dealing with mental health issues like depression and anxiety, where patterns of negative thinking can be deeply ingrained. Art therapy also encourages mindfulness, a state of active, open attention on the present. This focus on the here and now can help reduce feelings of worry and rumination, common features of both depression and anxiety. But let's not oversimplify. Art therapy isn't a magic bullet. It's a tool, one of many in the mental health toolbox. It might not work for everyone, and it's most effective when used in conjunction with other treatments, like psychotherapy or medication. Art therapy clearly has a lot to offer. But remember, it's not a one-size-fits-all solution. It's a journey, an exploration, a way of seeing and being in the world. And for many, it's a lifeline. So, can art therapy help everyone with depression and anxiety? Well, like all therapeutic methods, it may not be a one-size-fits-all solution. This video has delved into the transformative power of art therapy, showcasing its potential in combating mental health challenges like depression and anxiety. We have witnessed its effectiveness through real-life case studies and understood the science that underpins this therapeutic approach. However, it's important to remember that everyone's journey to mental well-being is unique. While art therapy can certainly be a beneficial tool, it may not work for everyone. If you're grappling with mental health issues, it's crucial to seek professional help, discuss your options, and find the therapy that resonates with you the most. Art therapy can be a powerful tool in the battle against depression and anxiety. offering a creative outlet for expression and healing. So why not pick up a brush, a pencil, or some clay and see where the journey takes you?